Every single year, 15 million people suffer a stroke worldwide, and here is the statistic that should stop you cold. 80% of those strokes were completely preventable. 80% gone, avoided, never had to happen. And yet, people are dying. People are losing the ability to walk, to speak, to hold their children, because nobody told them what a stroke looks like the day before it arrives. Because a stroke does not appear out of nowhere. It sends signals. It whispers warnings. And today, I am going to teach you exactly what those whispers sound like. Subscribe to Dr. Steven, the Green Physician, right now. Hit that like button, because this channel exists for one reason only. The system profits when you stay sick. Hospitals profit from treatment, not prevention. I profit when you don't need me anymore. Nature already has the answer, and someone needs to say it out loud. Picture this. It is a Tuesday evening. You have come home from work, tired but not unusually so. You eat dinner. You watch something on your phone. And then, somewhere around 9 p.m., you notice something strange. Your right hand feels oddly heavy. You shake it out. It passes. You pour yourself a glass of water and your grip feels slightly off. You spill a little. You laugh at yourself. You go to bed. You wake up the next morning, and the left side of your face has fallen. Your arm will not lift above your shoulder. The words you are trying to say are coming out wrong. Your family is screaming, the ambulance arrives, and the doctor in the emergency room looks at your family and says, "Did he have any warning signs yesterday?" And everyone goes quiet, because there were signs. There were always signs. You just did not know what you were looking at. That is the tragedy I have spent 20 years trying to prevent. I am Dr. Steven, the Green Physician, and this episode may be the most important thing I have ever recorded. So let us go straight into the medicine. What we are talking about today has a medical name. It is called a transient ischemic attack, or TIA. You may have heard it called a mini stroke, but I want you to throw that word mini out of your mind right now, because it makes it sound harmless. It is not harmless. A TIA is your brain firing its loudest possible alarm before the real disaster arrives. It is not a small event, it is a final warning. Here is what happens inside your body during a TIA. A blood clot, or a piece of arterial plaque, temporarily blocks blood flow to a part of your brain. The key word is temporarily. Within minutes, sometimes within an hour or two, that blockage clears on its own. Blood flow resumes. Symptoms disappear. And this is where the danger lives. Because when the symptoms disappear, people believe the danger has passed. It has not passed. The road that nearly collapsed is still cracked beneath you, and the next vehicle that crosses it may not be so lucky. Oxford University conducted a landmark study called the ABCD2 study, tracking over 10,000 TIA patients. Their finding was devastating. Among patients who dismissed their TIA symptoms and did not seek immediate attention, 10% suffered a full stroke within 48 hours, 10% within 2 days, and published in the Journal of the American Medical Association, JAMA. Researchers confirmed that the first week after a TIA is the highest risk window a person will ever face for a catastrophic stroke. 1 week, and most people spend that week at home, waiting, hoping, assuming. Let me give you an analogy that will burn this into your memory. Imagine the electrical wiring in your house develops a fault. The lights flicker for 30 seconds, and then come back on. You think, "Oh good, it fixed itself." But the electrician who comes to inspect tells you something different. He says, "Friend, that wire is moments away from starting a fire. If you leave tonight without fixing this, you may not have a house tomorrow." A TIA is that flicker. A stroke is that fire. And right now, millions of people are seeing the flicker and going to bed. Now let me destroy the myths that put people in danger. Men say it is just stress. Women say it is just a migraine. Young people say it cannot happen to them. And nearly everyone says If it was serious, the symptoms would not have gone away on their own. Every single one of these beliefs is wrong. And every single one of these beliefs has cost someone their life or their independence. The World Stroke Organization reports that 1 in 4 strokes now occurs in people under the age of 65. 1 in 4. This is not a disease of old age alone anymore. And the American Heart Association has documented cases of TIA in people in their 30s and 40s, linked to undetected heart rhythm disorders, hidden clotting conditions, and chronic inflammation that nobody was monitoring. Here is the most dangerous myth of all. My symptoms went away, so I am fine. This thinking, this exact thought, is what the statistics are built on. The symptoms going away is not the story ending. It is the intermission before the second act. And the second act does not have a happy ending for too many people. So, what is the real culprit? What is actually happening beneath the surface? The real culprit that nobody talks about enough is arterial inflammation combined with unstable plaque. Let me explain. Most people think of stroke as a simple plumbing problem. A pipe gets blocked, but it is far more complex than that. Inside your arteries, over years of poor diet, chronic stress, disrupted sleep, and processed food, a substance called atherosclerotic plaque builds up. Now, plaque itself is not always immediately dangerous. The danger comes when that plaque becomes unstable, when it is inflamed, when it is soft and volatile. Because unstable plaque can rupture, sending fragments into the bloodstream, and those fragments travel directly to the vessels that feed your brain. The day before a stroke, that plaque is usually at a tipping point. The inflammation is peaking, the blood is slightly thicker, the vessel walls are under pressure, and the body is sending signals through the nervous system, through the skin, through vision, through sensation. Signals that most people dismiss as tiredness, stress, or getting older. As a physician, I need to say something very clearly before we go further. There are specific symptoms that require you to call emergency services immediately, not tomorrow, not after you finish watching this. Right now, if you or anyone near you suddenly experiences facial drooping on one side, sudden weakness or numbness in one arm or leg, sudden difficulty speaking or understanding speech, sudden severe headache with no known cause, or sudden vision loss in one or both eyes, you call emergency services that second. These are not warning signs. These are the event itself. The time-sensitive treatment window for a full stroke is between 3 and 4.5 hours from symptom onset for clot-dissolving medication. Every minute of delay destroys approximately 1.9 million brain cells. I need you to never forget that number. Now let me tell you about one of my patients. I will call him Marcus, 54 years old, a project manager, the kind of man who managed everything and everyone, except his own health. He came to me not because he was worried. He came because his wife made him come. She had noticed that the week before, twice. His speech had gone slightly strange for a few minutes. He called it word-finding difficulty from overwork. She called it terrifying. Marcus sat in my office with his arms crossed. He told me he had Googled his symptoms and decided it was stress-related verbal fatigue. He had even found a forum where other people described similar things and blamed their workload. He was sleeping poorly, drinking 3 coffees a day, eating convenience food 5 days a week, and he had not had a blood pressure check in 2 years. I examined him. His blood pressure in my office was 158/96. Not catastrophic on paper, but consistent. His carotid artery, the major vessel in the neck that feeds blood to the brain, had an audible bruit when I listened with my stethoscope. That sound, that soft whooshing, told me there was turbulent flow. There was narrowing. There was a problem that had been growing quietly for years. I referred him for a carotid ultrasound and an MRI, and the imaging showed what I suspected: significant plaque buildup in the left carotid artery, and on the MRI, tiny areas of restricted diffusion in the brain, evidence of prior microinfarcts, silent strokes, events that had happened, probably over months or years, that he had never felt or noticed. His brain had been absorbing small insults quietly, and the two speech episodes his wife witnessed. Classic TIA. His brain was waving a white flag. Marcus looked at that scan and went very quiet. And right then, the picture clicked into place for me. Not just medically, but humanly. This was a man who had never been taught to listen to his body, who had been conditioned by decades of productivity culture to override every signal his body sent. His body had been screaming for attention, and he had been hitting the snooze button on his own life. We caught Marcus in time, but I want you to understand, millions of Marcuses are out there right now, dismissing their warning signs, waiting for something more dramatic to happen, and for too many of them, the dramatic event will be the stroke itself. Now, let us go deeper into the science, because understanding the mechanism is what gives you real power. Here is what is happening in the brain and blood vessels in the 24 hours before a significant stroke. The endothelium, that is the thin inner lining of your blood vessels, becomes inflamed and irritated under conditions of high oxidative stress, poor sleep, elevated cortisol from chronic stress, and dietary factors we will discuss shortly. This lining becomes what scientists call dysfunctional. It loses its ability to regulate blood flow properly. It becomes sticky. It allows inflammatory cells to infiltrate the vessel wall, and the plaque that may have been sitting there for years, stable and quiet, begins to destabilize. Researchers at Harvard Medical School published findings in the journal Stroke showing that inflammatory markers, specifically C-reactive protein and interleukin-6, spike measurably in the 24 to 48 hours before a cerebrovascular event in high-risk patients. The body knows something is wrong. The inflammation is detectable, but nobody is measuring it. Nobody is telling patients to watch for the physical symptoms that accompany this inflammatory spike. A study from University College London, published in The Lancet Neurology, identified what they called pre-stroke symptom clusters. These are collections of subtle symptoms that appear in the 24 hours before a stroke and are statistically associated with the event that follows. The cluster includes unusual fatigue that feels different from normal tiredness, brief episodes of visual disturbance described as a curtain coming down over one eye or sudden blurring, subtle confusion or difficulty finding familiar words, and a strange sensation of facial heaviness or tingling on one side. Not dramatic symptoms, not emergency room symptoms. The kind of symptoms that make you squint and say, "That is odd," and then go back to what you were doing. The tragedy is in that moment, in that is odd, because that is the intervention window. There is also a hormonal dimension that is rarely discussed. Cortisol, your primary stress hormone, rises sharply in the early morning hours between 4 and 8 a.m. This natural cortisol spike increases blood pressure, increases clotting tendency, and increases arterial wall tension. It is why the majority of strokes and heart attacks occur in the morning. When you add chronic sleep deprivation to this pattern, when your body never fully recovers overnight, the morning cortisol spike becomes dangerously amplified. Your arteries are under maximum stress at exactly the moment when destabilized plaque is most likely to rupture. Now, take a deep breath with me. Everything I have shared so far was the anatomy of the problem, the biology of the danger. But I am the green physician. I do not just diagnose problems. I prescribe what nature perfected millions of years ago. And I am about to show you that your body has allies in this fight that are sitting in your kitchen, your garden, and the wisdom of traditional medicine around the world. But first, the villains. Because there are three things that are aggressively worsening your stroke risk right now, and most people have no idea. The first villain is ultra-processed seed oils, sunflower oil, corn oil, soybean oil. These oils are extraordinarily high in omega-6 fatty acids, and when your omega-6 to omega-3 ratio becomes severely imbalanced, which it does when you eat processed food regularly, it drives systemic inflammation throughout your body, including in the walls of your arteries. A study published in the British Medical Journal found that people with the highest intake of industrial seed oils had significantly elevated markers of vascular inflammation compared to those who avoided them. These oils are in nearly every packaged snack, fast food item, and restaurant meal you eat. The second villain is chronic dehydration. Your blood has a thickness, called viscosity. When you are even mildly dehydrated, when you are not drinking enough water across the day, your blood thickens. Thicker blood moves more slowly. It is more prone to clotting. And clots in the brain circulation are exactly what cause strokes. 100 milliliters less fluid intake per day than your body needs may seem insignificant. It is not. Over weeks and months, it creates a biological environment where clots form more easily. The third villain is disrupted sleep, specifically, the loss of deep sleep stages. During deep sleep, your brain activates a system called the glymphatic system, a kind of internal waste clearance network. This system physically flushes inflammatory proteins and cellular debris out of your brain tissue. When you sleep poorly, when you sleep fewer than 6 hours, or when your sleep is repeatedly fragmented by stress or screen light, this system cannot complete its work. Those inflammatory proteins accumulate, your vascular health deteriorates quietly, and your stroke risk climbs with every bad night. Now, let us talk about nature's green pharmacy. This is what I call the green prescription. And this section, I want you to take notes. The first green prescription is Nattokinase. This is an enzyme derived from natto, a traditional Japanese fermented soybean food that has been consumed for over 1,000 years. Nattokinase has a remarkable property. It breaks down fibrin, which is the protein that forms the structural backbone of blood clots. It is a natural fibrinolytic agent. Researchers at Miyazaki Medical College in Japan published findings in the journal Nutrition Research demonstrating that nattokinase supplementation significantly reduced blood viscosity and fibrinogen levels, the very factors that make blood prone to dangerous clotting. I recommend 2000 FU, that is, fibrinolytic units, taken in the morning on an empty stomach. Do not take it with blood thinners without consulting your physician first. This is one of the most powerful natural interventions for stroke prevention that most Western doctors have never mentioned to you. Nature already had this answer. Science just took decades to catch up. The second green prescription is aged garlic extract. Now, not raw garlic from your kitchen drawer, aged garlic. The aging process transforms the sulfur compounds in garlic into stable organosulfur compounds like S-allylcysteine, which have potent anti-inflammatory and antiplatelet properties. A remarkable study from the University of California, Los Angeles, published in the Journal of Nutrition, found that aged garlic extract significantly reduced arterial stiffness and lowered levels of coronary artery calcification over a 12-month period. Your arteries literally became more flexible, more resilient, less vulnerable to the kind of pressure ruptures that precede stroke events. The dose I recommend is 600 milligrams of standardized aged garlic extract, taken with your evening meal. I take this myself every evening. This is what I call a green prescription. The third green prescription is Ginkgo biloba. Ginkgo biloba. This ancient tree has existed on Earth for 270 million years. Let that number settle. 270 million years. And its leaves contain compounds called ginkgolides that do something quite specific and extraordinary. They inhibit platelet activating factor, PAF, which is a chemical messenger that triggers platelet aggregation, meaning it stops your blood platelets from clumping together unnecessarily. Researchers at Brigham and Women's Hospital affiliated with Harvard Medical School published findings showing that ginkgo biloba extract significantly improved cerebral blood flow, the circulation specifically inside the brain. For people at risk of TIA and stroke, this is directly relevant. The dose is 120 milligrams of standardized extract containing 24% flavone glycosides taken in the morning. Do not combine with blood thinners without medical supervision. The fourth green prescription is omega-3 fatty acids from wild-caught fish oil. I know, you have heard about omega-3, but let me tell you what most people do not tell you about it. The specific components EPA and DHA, eicosapentaenoic acid and docosahexaenoic acid, do not merely reduce inflammation. They physically incorporate into the cell membranes of your arterial walls, making those walls more supple, more elastic, more resistant to the kind of micro tears where plaque begins to accumulate. A meta-analysis published in the New England Journal of Medicine reviewing data from over 77,000 participants found that omega-3 supplementation significantly reduced major cardiovascular events, including stroke in high-risk individuals. The dose I recommend is 2 to 3 grams of combined EPA and DHA daily, taken with your largest meal for absorption. Choose a product that has been third-party tested for mercury and oxidation levels. The fifth green prescription is hibiscus tea, Hibiscus sabdurifa. The deep crimson flowers of the hibiscus plant have been used in traditional medicine from Egypt to West Africa to Central America for thousands of years. Modern science has finally confirmed why. Hibiscus contains anthocyanins and hibiscus acid that act as natural ACE inhibitors, the same mechanism as a class of prescription blood pressure medications. A clinical trial conducted at Tufts University and published in the Journal of Nutrition found that drinking 3 cups of hibiscus tea daily reduced systolic blood pressure by an average of 7 points in hypertensive adults within 6 weeks. 7 points from a cup of tea. Brew 2 to 3 cups daily from dried hibiscus flowers, not a commercial bag. Steep for 5 minutes. This is what I call a green prescription. Now I want to give you the green protocol. This is my structured daily approach to stroke prevention. 3 parts: morning, daytime, and evening. In the morning, within 30 minutes of waking, drink 500 milliliters of room temperature water before anything else. Your blood is at its most viscous after 7 to 8 hours without hydration. This one act immediately reduces clotting tendency. Then take your Nattokinase and your Ginkgo biloba with a small amount of food. After breakfast, take 10 minutes for what I call vascular breathing, slow diaphragmatic breathing. Inhale for 4 counts. Hold for 4 counts. Exhale for 6 counts. Research from the National Institutes of Health confirms that slow controlled breathing directly lowers blood pressure and reduces arterial stiffness within minutes. Then go for a 20-minute brisk walk. Not strenuous, not a run, a brisk walk. Studies show that daily moderate walking reduces stroke risk by up to 27% in individuals over 50. During the daytime, eat your largest meal at midday rather than evening. Your cardiovascular system handles the metabolic load of a large meal far better earlier in the day. Avoid ultra-processed seed oils completely. Cook with extra virgin olive oil or coconut oil. Eat 1 handful of walnuts as an afternoon snack. Walnuts are one of the richest plant sources of ALA, which your body partially converts to EPA and DHA. Drink your hibiscus tea at 3 p.m. Stay hydrated with 250 milliliters of water every 2 hours. In the evening, take your aged garlic extract with dinner. Take your omega-3 fish oil with your largest meal. After 8 p.m., no screens. The blue light from phone screens suppresses melatonin and fragments your deep sleep, sabotaging your glymphatic clearance system. Sleep by 10:30 p.m. in a room that is cool and completely dark. Your brain does its healing work in the hours between 10 p.m. and 2 a.m. Protect those hours like they are medicine, because they are. Marcus, my patient from earlier, was deeply skeptical when I gave him this protocol. He told me he did not believe in herbal stuff. I smiled. I told him the studies I was citing were from Harvard, from Oxford, from the Lancet. He went home and did the protocol anyway, partly because his wife insisted. 1 month later, he sat in my office and said quietly, "My morning readings are down. I slept through the night for the first time in maybe 2 years, and I have not had another one of those episodes." He called them episodes. He still could not bring himself to say the word TIA. But his carotid follow-up showed reduced inflammatory markers in his blood work. His physician added him to an appropriate monitoring program. He was going to be okay. Not because of luck, because someone finally gave him the information he deserved. A few final pro tips before I wrap up. When sourcing Nattokinase, look specifically for products that list FU fibrinolytic units on the label, not just milligrams. The activity level matters, not the weight. For hibiscus tea, buy dried whole flowers from a reputable herbal supplier rather than commercial tea bags, which often contain low concentrations. And combine your omega-3 with vitamin E, 400 IU, to prevent the fish oil from oxidizing inside your body. An oxidized omega-3 does more harm than good. Now I must say this clearly because responsible medicine demands it. Do not start Nattokinase or Ginkgo biloba if you are currently on blood-thinning medications such as warfarin, aspirin therapy, or clopidogrel without first consulting your physician. If you are pregnant or nursing, consult your doctor before adding any of these supplements. If you have a history of bleeding disorders, please speak to a specialist before beginning this protocol. These recommendations are for educational purposes and are not a substitute for individualized medical care. How old are you right now? Write your age in the comments below. I genuinely want to know, because the age of the people watching shapes everything I create next. If this episode is reaching people in their 40s and 50s, I will make different content than if it is reaching people in their 60s and 70s. Your comment directly influences what I research and record for you. Here's what I want you to do starting tonight. First, drink a large glass of water before you sleep tonight, right now. Second, write down any unusual symptoms from the past week. Fatigue that felt different, vision changes, numbness, anything odd. Third, check your blood pressure tomorrow morning. If you do not have a home monitor, it is one of the most important $25 investments you will ever make. Fourth, begin replacing seed oils in your kitchen this week. Start with one swap, olive oil instead of vegetable oil. Fifth, book a basic blood panel with your doctor if you have not had one in over a year. Ask specifically for CRP, C-reactive protein, homocysteine, and a lipid panel. Sixth, begin the morning water and breathing practice tomorrow. 7 days of consistency creates a new biological baseline. Your body is not broken. It is not betraying you. It has been doing its absolute best with the information and inputs it has received. And now, you are giving it better inputs. A stroke does not strike without warning. The warning was always there. Now you know what to listen for. Now you know what nature has already prepared for you. The Green Protocol is not a replacement for your physician. It is the foundation your physician never had time to teach you. The system profits when you stay sick. This channel exists because that is not acceptable to me. Every video I make is an act of resistance against a model that treats symptoms and ignores causes. Share this video. Send it to the people you love, because the information in this video could literally be the difference between someone recognizing a TIA and acting, or dismissing it and paying a price no human being should have to pay. I'm Dr. Steven, the Green Physician, reminding you that nature already has the answer. You just need to know where to look. Take care of yourself naturally.